Fine.
We have to be good now. Recording has started.
Okay, I think we've got everybody pretty much here. I think Jane is perhaps missing, but I don't want to sort of truncate things. So welcome back, everybody, and we're going straight through now to item 9, which is our Herts Valley CCG consultation with Black, Asian and ethnic minority employees. And Paul Curry, I think you're going to introduce it. I think it might be helpful, Paul, if you just sort of maybe bring out some of the salient points. And also, I'd just like to say in advance for this discussion, what a really full and rich report this is. So, but over to Paul. Thank you.
Thanks, Nicholas. Yeah, I'm going to give a quick introduction and then open up for discussion. So firstly, I want to thank the staff that took part in the survey and the consultation. It was important that we both created the opportunity for staff to share their experiences and that they trusted the process and the intentions behind it enough to take part. The findings give us a clear and balanced picture of people's experience and views. Staff have told us what is good and where there is need for an improvement, and as well as looking to improve where needed, what's working well and learn from that. We're kind of in the early stages of learning from the report. We want to hear people's views on results and what to do next. It would have been easy to sit down and create an action plan that ticked all the boxes of the report recommendations, but we're looking for a bit more than a quick answer. So some of the key findings, a key finding is the report has told us that we need to look at cultural change within the organisation. Things like how our managers manage, how we improve cultural awareness and sensitivity, and how our processes such as making opportunities available to staff can be improved. These are things that aren't improved by me making a quick action plan. They are improved by the organisation, both its staff and its leaders, arriving at a consensus of what to do and committing to it. From that, an action plan can be developed and agreed and is more likely to stick because there is that consensus and that commitment to it. We've recently established a Black and minority ethnic staff network, and they've just started meeting and discussing the report, and the executive and the senior leadership team will be discussing the report and sharing their views. And we brought it to the board because we want the board to be involved in this discussion as well and to share their views and ideas. And then all of these comments and ideas will be fed into the development of the action plan, which will be agreed and shared. So at this point, I'd kind of like to open it up for discussion. I said there's a lot that's really good in this report. I don't want to lose that, but there are some clear indicators of where we need to make some cultural changes and organisational changes. And I want ideas and comments and your involvement in how we go about that.
So thank you. I think it's just worth also reminding everybody that this has we've been discussing this quite a lot at board. It was certainly highlighted at some of our previous board meetings during the summer. So really important sort of now that we discuss this in the public arena. And I'm also really glad to say that we have several members of our Herts Valley's employees who are actually dialing in today and observing this. So over for comments, please. David, to start with, yeah.
Thank you, Nicholas. So I think this is a really important document that we need to reflect on and have an open, transparent conversation about, and one that actually I'm glad we've got on the public board meeting today so that the public can see how we're developing our response to what is a really powerful document. And if we align it to some of the work that we've done over the past years with the staff survey, and we mentioned that earlier, it's really important to understand the journey of our organisation and some of the institutional behaviours that we need to tackle going forward. And there was always a perception sometimes within our staff questionnaires, from the NHSE questionnaire, that there was elements of potential bullying and harassment in there. And what I think this does is really define and give us the next step to work out where some of that is happening, whether that be through a cultural or organisational process, and how we can ensure that we have open dialogue around managing some of those challenges going forward. I think the BAME network is a really positive move forward, and some of the work that has been led, and at staff briefing yesterday, Maria Ula talked about the key aims of it, and I mentioned them earlier in my MD report. But I think it's really considerable effort has been put into ensuring that we have the right topics, the right conversations, we break down any myths, and we do the cultural work within the organisation about wider understanding. The recommendations in the report are ones that we do need to act on. And I think, as you said, Paul, it's understanding once we know what the direction of travel is for this organisation, a commitment from the board, we then put those actions into place. And some of those areas will be around ensuring that we have appropriate cultural awareness for interviews, that we're aware of people's different requirements and needs in life, and how we then integrate them into the organisation to get the best out of our staff, because we're a collective of staff, and I think that is the journey we should be going on. And also aspirant leaders as well comes out in here. How do I aspire? Where do I aspire to? Where do I see those aspiring leaders that I can latch onto and see that it will improve my ability to go through a journey of development. So there's some really key findings. Also, there's some strong inferences, and some people that feel have been really discriminated against and hurt within the report. And I don't think we should shirk over those comments. They are absolutely powerful comments. And when I read them as managing director, my heart sinks a bit, and it makes me want to actually tackle them directly and say, actually, okay, what can we do to make sure that we don't get this kind of comment in a year's time, and that people aren't feeling either discriminated against, oppressed, or not having the ability to climb. Words like cronyism and words to that effect are ones that we shouldn't accept in this organisation and should be challenged. And I would hope they wouldn't be there, but obviously in an organisation that employs 230 people, we need to ensure that we're stronger on our line in that. So there were just some headlines from my perspective, Nicholas. I can see hands popping up left, right and centre, which is fantastic. So I will not take up any more airtime, pass on to someone else.
Well, I think it was Hein, Alison and then Rami. So Hein, thank you.
I think I was in before Hein, actually, but you always forget me, Nicholas.
Oh, okay. I've forgotten you again, have I? Sorry, Paul.
But okay, don't worry, come to me in due course.
Okay. I'm happy to stand back for Paul.
Well, thanks. Okay, I mean, I will just go. I mean, I thought it was a great report. The verbatims for me were the most interesting part of it, actually, because the level of feeling that people were expressing in those was actually quite shocked me. I would not have been surprised had people said, yeah, I feel I've occasionally been bullied, bit of harassment, but the strength of some of the comments were really quite shocking. There's two things coming out for me here. One is on the bullying harassment side. I think it's a bit higher than you see on the total staff survey, but not hugely higher. And so my sense is that bullying harassment is not so much, didn't come out to me as so much of an issue as the sort of the opportunity thing and the being treated fairly and the opportunities for promotion. I suppose the only other thing that concerned me about the report actually was as the whistleblowing guardian, champion, whatever it is I'm supposed to be. I've had one call in 5 years, I think, and it may be that we should reflect on who is the right sort of person to be the whistleblowing guardian for concerns of this nature, because it might be that they think that a white, I'd like to say middle-aged, but I don't think I qualify for that anymore. A white middle-aged white man is not the right person who they want to about these sort of concerns. So we may want to think about one of the actions. Where do they go if they have these concerns and they want to raise them outside the process? I mean, we have a speak up guardian in Alison, but you know, we need to give people the opportunity to raise these things outside of the formal structures as well, so that we can deal with them. That was all I wanted to say. Thanks, Hein, for letting me get it off my chest.
Thank you, Paul. Shall we move on and then perhaps have a more of a discussion in the round? So Hein, over to you. Thank you, Paul.
So I think the only point I want to make, Chair, is that I think this report helps us to have a discussion about race. I think it is really important that we speak not just to the BAME community, but also to our wider workforce in terms of how people are perceived in terms of their behaviour. And I think part of this discussion will help us to better understand the impact that managers have on staff and the perception that staff have of their environment. I think it will also help us to better talent spot people appropriately and put in place the right development mechanism, and engaging specifically with our BAME community in terms of finding the right solutions rather than, as Paul said, middle-aged white men decide what the solution is. We engage with the BAME community and say, this is what you've said, factual or perception. How do we best address this together for you? And I think it is really important. We did discuss this at Hearts Valley's senior leadership team. What is the action plan that we're going to do? And we step back from that and say, well, we're not going to just make an action plan. We are going to engage with the BAME community, with the BAME network, and with the people that participated in this report so that we develop the next steps together.
Thank you, Hein. Alison.
Okay, I think in terms of delivering the cultural change that we need to deliver around this, we need to make sure that we don't other this in terms of making it an HR responsibility or even an HR-led responsibility. I mean, it's a fantastic report, Paul, and it's a real, I mean, it's a shocker as well, a real eye-opener when you read some of the feelings there. But something that comes along, I mean, a lot of the comments relate to the fact that actually this is not a separate issue. We have to address this team by team. We have to allow these discussions to occur within teams, within strands of work. It's not a separate community or a separate issue. We've got to think about how we deal with it across the organisation and within the organisation. So I just wanted to make a pitch. I think it's a kind of almost like we have to address it piece by piece, conversation by conversation. And that's the way we'll actually get real change rather than making it a culturally separate issue. It makes me think of how women's issues used to be women's issues they used to be organised just for women. And I think we've got to make sure that we don't fall into those old traps again. That's it.
Okay, sorry, Alison. I don't know if I can be heard or not. Sorry, I don't know if I can be heard or not. But
yeah, we can hear you.
Was there anything else you wanted to say, Alison, or was that your sort of main point? Yeah, thank you. Rami, and then Avni, and then Paul Curry.
Yeah, I think, when I read the report, I had the same heart-sink feeling that David and the rest of the board had. But I also felt that this is an important topic to actually put on the table and not to just have it as part of an agenda and as part of a discussion. And maybe the way forward is to actually make it actual day-to-day practice, that there is a line of discussion in a formative way to support any feelings that suggest any member of the organization feels that things have not gone in the best way forward. And the only way I can see that actually happening is actually having it at different levels, depending with the individuals, that not everything has to be escalated to someone like Paul or someone like Alison. I think that just puts such a barrier for some people that's why they probably aren't getting as many contacts, because you feel by the time I get it to that point of view, there will also be a major decision that will affect my promotion, my livelihood, my place within this organization. So can we maybe look at a multi-leveled structure of discussion, and then to deal with the issues at hand, not to deal with a particular grouping, with a particular gender, with a particular anything, to actually deal with the issues. And if the issues are structural, they have to be escalated. If the issues are part of a work stream, they can be dealt with at the work stream. To me, that seems to be the way we're going to get much more engagement and also have much more positivity.
Thank you, Rami. Avni.
So I think, just building on to what everybody has said, this report has actually, makes everybody shocked, if anything else, and the heart sinks. But I have to admit that as an organization, I'm really pleased that we actually did this piece of work, because I think over years we have not really understood what the results of the surveys have actually told us. And like Paul said, it is less about bullying and harassment, and it is more around the equal opportunities bit, which we would have never picked up. So I think the richness of this information, and hats off to Hein and team to actually take this forward, is absolutely stunning, because for me, the results were absolutely shocking. I absolutely agree that there needs to be forums whereby we can have open discussions and actually make this everybody's business. There is no way we can just have dedicated BAME discussions and all of that unless we actually have that cultural change in the whole organization. We need to reflect that in our values. We need to do that, because I think unless I was just walking in the forum or Hemel One blindly, I have not seen this. And for me, this was really a shock as a BAME, if anything else, as to what is going on and how do we actually come together and support this agenda really well.
Thank you very much, Avni. Paul Curry.
Yeah, it's picking up something Alison said. Maria at the staff briefing yesterday was really clear that from the BAME network point of view, this isn't about BAME staff only. It is about how they can support the organisation to pick this stuff and learn from it, and it becomes about all staff working together. Just a couple of other quick things. At an ICS level, the equalities leads are picking up on some of this stuff. So we're looking at developing ICS-wide unconscious bias and cultural awareness training, and we're looking at recruitment processes across an ICS level. So some of this stuff we know happens within other organisations within the ICS. And we're picking up those things and looking for solutions. And all this will kind of fit into how we fix some of the challenges within Herts Valleys. It's also worth noting that we're repeating this survey in the other two CCGs, and the reports for those will be out in the beginning of February is the current timeline, and we're on track for that. And they'll be learning that we pick up here that we'll be able to feed into the other CCGs, because there will be some things that are shared. So this is part of an ongoing process. Herts Valleys has been sort of the champion of this and got things moving and got a really good report and can learn from that, but it will impact across other areas of the other two CCGs and the ICS.
Thank you, Paul. I think it was Karina next.
Thanks, Nicholas. So I'm not going to repeat what the others said about how shocking this was. It was indeed very shocking to me, having worked in the CCG since pretty much its inception. And I would have never guessed that people think that way. Now, some of the comments I felt that were very, very much a matter of perception. I very much doubt that in our CCG we've been handing over jobs without interviews. I'm fairly confident that a lot can be contradicted by showing our audits and so on. But clearly there is something which we don't do, or we don't do rightly, so that people are left with this perception. So there is something there which is not so obvious, but we need to reflect on. I was reflecting myself on it last night and thinking, what is it that we can do to change people's perception? Thanks.
Thank you, Karina. David.
So I just would like to add in some of the feedback that we got from Maria Ula at our staff briefing yesterday, and I said some of it at my report, but I think it's just good to reiterate. And we talked about it being everybody's business, and I've seen comments in the side chart, which I think is absolutely spot on. This should be just our business. And actually the BAME network aims have come up with promote more happiness. We don't want the focus to be on concerns. Create a sense of unity, not division by being BAME staff. Encourage understanding of culture and religious backgrounds, and encourage non-BAME staff to attend our events. And one of the lines that I was sent was the group felt that people assume such group is created to differentiate a certain group to others and to talk about their issues. The network members did not want this to be the message about the BAME network, but that the network's aim is to create a platform for BAME staff to encourage unity with everyone and not division, promoting positivity. And I just wanted to put that back in the room, because that's really inclusive. That is conversations. That is, and what we need to do is reach that message, because I think it's brilliant across the rest of the organisation to make it everybody's business, and that there is that continued conversation, because then it can dispel. If there are myths, they can be looked into, they can be worked with, but also there is definitely stuff that we need to grab hold of and change, as we've talked about today, in a way that is completely inclusive. So I just wanted to add that in, Nicholas, because it was in a really, I think they've done a lot of work and we can learn a lot by integrating everything now. I think that's the important key for me.
Okay, I think it was Juliet, and then actually back to Paul Smith, then Alison. So Juliet first, please.
Hi, yeah, thank you. Just a couple of brief thoughts. One is, in terms of this being a topic which shouldn't just be put in a kind of a box or a pigeonhole, just to say that yes, as I think Hein mentioned, we've talked about it at exec, it's been talked about at SLT, and also at Staff Involvement Group, which is a group that I chair, and it will continue to do that. So it isn't just going to be a topic that just sits in a particular box, if you like. The other thing that I was going to say really struck me in this conversation in particular, how many people have said that they're shocked by the results. And I suppose what that makes me realise is that one of the key actions, I think, is around training an unconscious bias, because actually, you know, the fact is we all do it. We all, in the way that we operate on some level, operate some kind of prejudice, because that's kind of the way that we are. And I think there's research about unconscious bias, which is really powerful. So, you know, the fact that we're shocked, I think, is partly because, you know, we don't think we do this sort of thing. We don't think that we would think differently about somebody or somebody's application for a role because of their ethnicity or their gender or whatever. But actually, it's really common. So I think for me, that's something which would be, I think, really helpful. And I think I've had some very good feedback about unconscious bias training. So I think it'd be a really good thing if we can get that brought in.
Okay. I think it's Thelma next. So Thelma, please go ahead. Thelma, we don't seem to have you on sound. Should we come back to Thelma and then go to Alison again? I know Alison we've had. Sorry, it's Paul Smith.
No,
Thelma, are you there?
Mine was a legacy hand. Don't worry.
No,
okay.
Mine was a real hand though.
Fine.
So
okay.
If you don't mind, I just really wanted to support absolutely what Paul's been saying. The way we will change perceptions is by dealing with what has caused those perceptions to arise. If we start to say it's about perception, then we're basically shifting. They're saying it's a little bit like the politician's apology. I am sorry for any offence that you might have been caused. We really have to talk to those people who've got those perceptions and say, what is it? What is it that we can do? What actions can we take? And Juliet, absolutely, I want to go to that unconscious bias training. I think it's so, you know, I think we all think that we're doing the right thing. And I think even more than people who don't think they're doing the right thing, you know, it's a little bit like we need to be more conscious of we think we're good at this, but there are ways we keep getting it wrong. So we need to be more conscious, and we need to really to accept that these perceptions are arising because of things that we are doing.
Fine.
Sorry,
Thelma,
I think I'm back now. Can you hear me?
Yeah, we can hear you. Great. Okay.
Yeah, I'm sorry about that. I'm sorry, I've been listening to what people say. I get really annoyed when people say I am shocked. Why are we shocked? And I'm saying this, it's not just the CCG, because as the LGA, we've also gone through an exercise where we got external people to come in to do some work for us. And, you know, management just says, I'm shocked. Why are you shocked? What evidence do we have that we're making sure, even before this survey came out, that everything people are concerned about are being dealt with, so it doesn't happen at all? In terms of having, I mean, I have always been very cynical about having networks, because if things are being done properly, if there's fairness and equality, if people who have issues are being addressed so that they're on an even playing platform to be able to compete for jobs or opportunities, to have different experiences, you wouldn't need a network. And the point that Alison made, it was like the women's issues. In those days when there were discrimination against women, there was a women's network, and then you have a Black network, and now you have LGBT network. Racism exists. It exists in organizations, whether or not it's conscious. We've had equalities legislation for a very long time. We need to consciously do something and make sure. And I don't accept this concept about perception. Perception or not, it does exist, and we need to address it, rather than saying it's a perception, I'm sure it's not right, and we have evidence to rebut it. That's not what we should be doing. We need to listen to what people are saying, and we need to address them, so we move them from the area of how they feel to making sure they feel part and parcel of an organization. They get the opportunity that is needed for them to do what they want. It is not a Black problem. It is not a women's problem. We all have responsibilities. Black people, disadvantaged people are not in the position to make the change. We can help, but we're not. It's those in position, it's management who can make those changes. But we all need to work together, and the board has a responsibility to make these changes. So let's stop making excuses, listen to what people have to say, and just get on with it.
Okay. Thelma, I think that's so powerful. I think it's very hard to actually even know what to say after that. Is there anybody else that particularly wants to come in here?
Nicholas, I think Trevor's been trying to come in.
Oh, sorry, Trevor. You're right. Yeah, Trevor. Sorry.
Yeah, I mean, I think the point's well made that you know, reality perception, it doesn't really matter. This survey has brought out these issues, and they do need to be addressed. And I think I do agree that it's no point trying to address them as a side issue. They have to be in the main agenda that we deal with. And I suppose that I think the positive is that, in my opinion, a lot of these things can be sorted out by transparency and good communication, which is often what maybe is missing. And those are fundamental principles that we as an organisation have. So I think, although there are negative aspects to this report, which maybe because of unconscious bias we do find surprising, I think it's important that you know, we do look at our core values of transparency and communication, and use those in order to. That's all from me.
Okay. Anybody else that hasn't spoken? Thelma, did you want to come back? You've still got your hand up.
I'm sorry, it's a legacy hand.
Okay. I think that the other point that I just wanted to make is that, you know, having now sat on the BAME group that is sort of discussing this, I think that it is absolutely board business. It's every single individual within the board. And the other point I'd just like to sort of draw in is that we are a member practice organisation, and we also need to be reflecting on the behaviours of our GPs and our GP practices in this. I think that is another discussion, but I think it needs to be part of it in the round. And I mention that because we know there are groups that have approached both myself and Prague in East and North to talk about how they perceive the racism and the lack of opportunity for certain groups of GPs. In particular, this was the Afro Hearts GPs, but I'm sure that could equally apply to other groups as well. So there is business to be done. And as we move into legacy or new organizational forms, we've got to make sure that this discussion is absolutely integral to the beginnings of those new organizations and not something that is considered 2, 3, 4 years down the line. So I think this is really important business. And I suppose it's a rallying call to say, everybody's a part of this, everybody has a role to play, and we cannot actually tolerate that those perceptions or the real issues of racism are not dealt with over the months and years ahead. So I think we were asked to let's just get it right. This was a discussion item. Paul, I think there's much to reflect on, and I really hope that the discussion has been rich enough, and that those that have been observing this will also, I'm sure, have their views and reflect on what's been said today. But I think some really powerful interventions today, discussion points, and thank you very much for the richness of it. Thank you. Okay, I'm going to move on now to item 10, and I understand that Claire is going to be filling in for Amanda, who's had to give her apologies today. So Claire, are you there, please?
Hi, Nicholas. Yes, I'm here. This board report just provides assurance to the board in relation to our EPRR. I won't go through the report in detail, but just want to say that there has obviously been less training and exercise has taken place this year due to COVID. Some were carried out that are listed in the document prior to the pandemic, and some of our plans have obviously been tested during the pandemic, and we have been looking at lessons learnt, and we are discussing them later this afternoon as well, so we can get some rich discussion about how we move forward in relation to incident management. I could just say that it has been a lot of on-the-job training this year and been very valuable. There will be a new programme of training implemented in the new financial year. We've also been self-assessed against the NHSE core standards for EPRR as fully compliant this year. We did have a peer review which took place in October. NHSE scrutinised and tested our evidence, and they supported our assessment of full compliance. It was a light touch this year on the assessment against core standards, and they did mainly cover the COVID and EU related assurance issues, but did take an update on the progress from last year's submission. The overall system has been declared as substantially compliant. Jane Halpin has written to NHSE to confirm this. We did all the assurance meetings with our providers as well. So, any questions?
Yeah, I'm looking here, Claire, to see if anybody actually wants to come in. I'm not sure if Jane has actually been able to join us yet, or if Jane would. Oh, Paul's got his hand up. How can I miss Paul?
Oh, the system's working at last. Thank goodness. I mean, I thought it was sort of ironic that we're fully compliant on emergency planning and resilience and all that stuff when we've actually gone through a real pandemic, and so much of the services that we've been trying to deliver have been so badly disrupted across the entire patch. Which it isn't to say that people have been working incredibly hard, but at the same time, one of the things that we actually did was a tabletop pandemic flu exercise in October 2019. And we test ourselves against standards that are written down by NHSE, do a tabletop exercise, and then an actual real pandemic comes along, and it surprises us. So I think the question isn't so much whether we're fully compliant with the standards as to whether they're worth the paper they're written on. And perhaps when you have the discussion this afternoon, one of the things you should be trying to pull out is how does the tabletop exercise on pandemic flu compared to the real world of a proper pandemic, and what difference does it make in terms of the sort of actions you assume and the impact on the entire system and all the supporting infrastructure, that goes far more than anyone ever really wanted to think about. So that was my only observation. I'm sure we are compliant with the standards. I'm just not sure what they're worth. Over.
Paul, I take on board your point, and I think that is why they did what they called a light touch on the core standards this year, because they're aware that we're actually in the midst of our biggest learning exercise ever. We are managing, as David said in his report earlier, and we've done an awful lot of new ways of working, which we'll highlight later this afternoon when we discuss it. And you're right, I think we can't not look at what we're learning now during this while we're managing the incident, because we can't wait till the end as we would normally. So hopefully it'll be a nice rich discussion this afternoon, and we can take away some amendments and changes that we can really benefit from.
Yeah, I think it's just worth saying, which really iterates Paul's point, that of course the planning was done on pandemic flu, not on pandemic coronavirus. And I think that is something that has also had quite a lot of national attention as well, that the thoughts and the planning were based around an assumption that that would be where the pandemic would come from. And clearly, as we all now know, unfortunately, it didn't. So I think that's actually what we're asked to self-assess against. It also has to be questioned, I think, in the future in terms of planning. Does anybody else want to come in? I'm gonna actually take that as a no, and so thank you very much. That was for assurance. Thank you, Claire, for helping us out with Amanda not being here. The next item, which is the annual Sustainable Development Report, is also for assurance, and I think Avni, you're going to help us out here due to Amanda's absence. Thank you.
Yeah, no, thank you, Nicholas. So what you've got in front of you, I'll take it that the paper has been read, but it's the CCG's annual progress in relation to sustainability development for 1920. Obviously, I think some of the key points to mention from the paper. So the CCG's overall carbon footprint is increasing purely because of due to the organizational growth. So we can see as more people have been appointed to the CCG to do more work, if anything else, that does lead to more carbon footprint. But I think because of the way we are working and how we have moved, especially in 1920 from Hamel 1 into the forum and all of that as well, the carbon footprint per individual staff has absolutely reduced. So it's going in the right direction in terms of what's required for it. Overall, obviously, in terms of the tool achievement, we are improving, but it is not as in terms of significant improvement. From 57% from the previous year, we've gone to 61%. So that reflects some of the work we are doing, but I don't think it's ever enough. There is always more to do in this sorts of things, and how we need to do that is going to be the next bit we do. Some of the issues that we have encountered in 2019, purely because of the changes that we've had. So things like gas, electricity, water, all of those are really managed centrally by landlords. So we don't really have that much of an impact, so to speak, to make some of those changes. But overall, obviously, we are looking into that with Amanda, working with the council colleagues as well. What it does is it sets out obviously what needs to be done around sustainability moving forward, and obviously includes the alignment of the plan to the NHS Zero, which is, I have to say, it's an amazing challenge to get to, if anything else. So we are making slow progress on it, and working through in terms of premises, work that needs to happen with staff, looking at it in terms of all the carbon footprints with printers and paper and all of that as well. And how we actually work with our providers as well, because one of the things that the tool also asks us is actually how are we procuring services? How are we actually ensuring that they are putting plans in place in terms of sustainability development as well? And that has been an absolute key focus, and hence the procurement policy, which has been reflected, changes that to say, there are certain standard questions, but more enhanced questions as well in any procurement for any providers that we do, to give us the evidence of what plans they have put in place as well, and how we monitor them as well on that one. So I'll take that as the paper in terms of a short summary, but any questions? And I can already
say Trevor, and then, okay, thank you. Trevor, then Paul, thank you.
Thank you, Avni. Great overview. As you say, I think probably this year will have moved us a lot further along the line, both in terms of travel footprints and paper usage and all that kind of stuff. Obviously, building wise is what it is, but that is a lot smaller than we had 2 years ago. So again, I think these are all positives. I think the point was well made about providers, because there's an awful lot of paper that still comes into GP practices from providers, and therefore, we appreciate there are IT issues with one of our main acute providers, but that has really got to be a priority for the future. And I know it's part of the whole SOC system, SOC, and IT is a key linchpin in this, both for efficiency and for sustainability. So I think I think we need to keep pushing our providers very hard on that. Thanks. That's me.
I think that's a point really well made, and we know that while the work on the West Herts Trust, especially for us, is underway, but obviously across the ICS, I know that Trudy and Rachel Joyce are absolutely working in terms of shared record, having shared record systems as well. So sharing of records itself will make a difference rather than actually paper pushing some of that as well. So we are trying to do everything in that sense to make it as paper light as possible.
Okay, Paul, then Rami.
Thank you. Good report. I think we need to think going forward about the impact of people working from home, its impact on travel plans, but also making sure that we take into account that we don't think we get a free lunch on things like utilities simply because people are using their own electricity and gas. Because I think anyone who's looked at their quarterly electricity bill over the last 12 months has had the same sort of nasty shock I've had from having computer monitors running all day long and what have you. So I think working from home is something we need to factor in all aspects of it, both the pluses and the minuses.
Yep,
Thank
really
you,
important
Paul.
points. Yeah, I concur with that. Rami.
Yeah, I just to add to the point that's already been made before, I actually had someone come and look at our systems from a sustainability point of view, and the one thing that they highlighted beyond all in our practices is still the fact that we are so paper dependent, that there is so many piles, that a lot of stuff comes from all the other providers in paper form, that paper has to be both printed, rescanned and resent. I hope that, if we are going to use a report like this effectively, we have to have some specific areas that we feel we can actually make a substantive difference on. And I think I cannot stop a lot of people using cars if they have no alternatives and there isn't public transport. I can encourage them. I cannot leave people working from home without their computers running and in the cold, but I can look at the amount of paper we're doing. Maybe we need to actually focus.
Thank you, Rami. Definitely, I'll take that on board. So I think the table that you've got in the paper is quite high level, which basically talks about commissioning, procurement and all of that. So they're quite lumped in together, but there is a detailed report underneath it, which actually talks into account in terms of paper and all of that. And I think what we now need to do is to focus our actions that are realistically and targeted to the areas that we should do and where we have an impact on. So I think that's a point well made. I'll take that back with Amanda.
Can I just follow with one other thing? I think the CCG also is now doing some project about digitalizing paper records. And that's part of what we were looking at in my own practice and how we do it. So maybe this is a great opportunity that once we digitalize, we actually have a push for a paperless approach from a point onwards.
Yeah, that's correct in terms of the Lloyd George records in primary care and that business case. Yeah, we'll bring an update on that.
Okay, Paul, we saw your comment about try not to reply to all with the carbon footprint that an email gives.
There was a lot of articles quite recently, I think, because of all the working from home, that actually, emails actually drive it, and it had quite a substantial carbon footprint. So getting rid of paper is a great thing to do because it's far more efficient anyway. But emails have a tail as well that you need to be aware of. And the propensity everyone has for hitting reply to all when they say things like yes is quite remarkable.
Yeah. Okay. So if we can, Avni, thank you, and also if we pass on the thanks to Amanda, who obviously produced the report and couldn't be here today to present it. Now going to move on to performance section. So joint quality and performance report, which Claire is going to present, and it's an attachment for assurance. Claire, over to you.
Hi, yes. Before I go through the report, I just want to let you know, just because of the timing of the quality meeting and the papers going out, this report obviously is from our previous quality meeting in October, so the data is not as update as it could be. I do have the report for the next quality meeting that's actually going out today, so I do have a more up-to-date position if needed for the August data. I'm sure my colleagues will chip in at various points, but I'll just start with the overall performance of the 4-hour wait. I'll go through each area as we go through. So as you can imagine, the 4-hour performance overview hasn't changed much. It's been put under quite a lot of pressure during COVID. One of the asks from the board members was to see what impact COVID has had on the performance metrics as well. And in the report that's going out to the quality committee, we are actually looking at the fact that actually COVID hasn't impacted this metric, that although numbers may have dipped at points during the last 6 months, that the performance metric hasn't improved purely because of the difficulty of getting people through ED while doing a lot of COVID swabbing and testing, which has slowed it down, even though there's been less people going through the doors. Does anybody want to chip in on that, or shall I go straight through to RTT? Okay, I'll go on to RTT. So the performance, as we're aware, is quite concerning on our pathways and weights. We have been working very closely with West Herts on looking at the waiting list and the performance on this. One aspect of this is the diagnostics, and they are struggling to actually maintain performance. The last figure I have has slightly improved. We're not as bad as we have been during the pandemic. At some points we hit down to 51%, but we're on 70.2% for August. The numbers of patients waiting than a year, as you would imagine, have increased. They were in single figures at the beginning of the year, and as the pandemic has slowed the ability to manage all the routine appointments, we've seen those creep up, and we are for August at present on 715. We have a very robust process now of clinical harm reviews looking at those people on the waiting lists. There is an ICS STP-wide protocol that they are adhering to go through these patients that are waiting. And as yet, we have had no SIs reported in regard to long waits. It's not a satisfactory position, and that's why there's so much highlight on that piece of work. I don't know, Avni, if you want to say anything more on that? No. Okay, I shall carry on then. I'll take any questions at the end. The other hospitals that we are looking at are Royal Free. They have been having some formal reporting because they've had some variation issues. This is continuing at the moment. In September, the position for 52-week waits for Herts Valley's patients are in the region of 254, which is virtually the same as it was for the last report as well. The other, sorry, I'm flicking between two reports to give you the most up to date, so apologies there. As you can see, the clinical harm reviews as well at all the hospitals are looking at the highest numbers and the specialties that have got the longest waiting lists. And as you'd expect, this is where the focus for the harm reviews have been as well. I'll move on to cancer. The cancer performance summary is actually quite a good news picture, although during the first stages of the pandemic, the performance did drop. We are seeing a good recovery there, and West Herts are performing really well. The most up-to-date data on that, sorry, just flicking to the most up-to-date report, we have all cancers 2-week weights at 95.8. And all metrics are in the green apart from our 62-day wait, which is not available at the moment, but we're processing that. Okay, let's flip back to my other report. This is where you need 3 screens working at home. Patient experience surveys have carried on throughout COVID. I know we had some questions previously from some of our patient reps around that. We are doing that, and we are actually doing a lot of assurance work with the trusts while to ensure that all that work is still continuing, including some of our quality visits have been taken virtually, and they've been very successful on that. I won't go through any of the other performance in detail, but we'll be happy to take any questions.
Okay, thank you, Claire. I think Trevor's kicking us off. Yeah, Trevor.
Yeah, so thank you for that. And obviously, the figures are sort of moving rapidly, sort of month by month. So certainly with the RTT issue, I mean, obviously that seems to be increasing, both because of obviously the reduced capacity, but also the increase in, my worry about this, I don't quite understand the plan, and I would like a bit more detail in that, because obviously there's the backlog and the catch up, but equally we're also going to have increases in referrals as, you know, as we come out, as GPs have found, you know, a lot more patients are presenting and we're needing to refer more people in. So this is going to be quite a sustained problem, and I suppose a clearer view on the plan would be helpful, both for GPs and the public, obviously.
Obviously, so some of the plans there are to continue using the independent sector, as you're aware, Trevor. There've also been a plan within the hospital just to build some more capacity. So they're looking at utilising all 6 theatres, but there was a little delay to that due to a breakdown in a ventilation system that's now been rectified. So hopefully we'll see the impact of actually that being fully operational soon. But as you know, there's always that backlog and being added to the list at the time. And hopefully October is when we're planning to see the improvement in those numbers happening. So I don't know if we've got any off the record data for September, Abney, but I know, you know, that is when we're planning to see the impact of their plans being put into place.
So we should be seeing sort of a peak in sort of September, October, and then hopefully should see numbers coming down. Is that right?
So if I just come in here, so I think there's a couple of issues there. So we know in terms of RTT, there are at least 3 to 4 specialties whereby actually they will be struggling, irrespective of all the, irrespective of, you know, utilizing the 6 theatres and the independent sector. The reason being, for pediatrics as well as for oral surgery, we have not been able to identify appropriate providers to actually take on this activity. Now that has been posed as a risk, and we're working that through as an ICS, especially for West Herts purpose, purely because we, at the moment, our independent sector cannot provide us with that particular 2 areas as well. So we are looking at it in terms of impact and everything else as well. So we will get further information and working with the trust closely on those 2. The other areas whereby, especially around TNO, ophthalmology and ENT, as we all know, they're the main 3 areas where there is a backlog. The significant backlog is in ENT as well as a few bits in TNO. Now, both of those, obviously, there is a role for independent sector to play with, and they are actually absolutely working with Spire to actually see what capacity can be delivered from that. However, in ENT, there is 2 parts to it, which is around pediatrics and adults. So adults were successful with the pediatrics. We're still working through the detail of what's required on that. So in terms of assurance, and as discussed at the quality committee last month, when we had the last meeting as well, is we're absolutely working with the trust in the detail of each specialty rather than just looking at it as overall, because the numbers over here just give you high level information. But what we are, as Claire has outlined, the MDT is really working at each specialty and looking at it in terms of how we would actually tackle this, and where there is an opportunity working as an ICS. And if there is capacity in the other 2 providers, then we will seek and get that seek that capacity. But at present, what we're looking at is probably outside our ICS in terms of those two areas, in terms of pediatrics and oral. That's critical. The other bit, Trevor, just to add to your point, if anything else, is you're absolutely right that this is not just the backlog numbers, but obviously as new referrals are coming in, as I would say, the bucket is getting fuller and fuller. And there is something around trajectory and actually looking at it to say, you know, when is it realistically while we're going to get back to normal, or somewhere near normal, or the new normal, should I say, if anything else, because at present we've got to understand that COVID is not yet going away, and hence there might be a new normal that we would have to work with rather than actually saying that we'll be back to previous normal. The bit that I think we're really keen to ensure, where patients are absolutely waiting in all of this, and they have been waiting for long, what does that mean for them in terms of once the referral has gone from a community provider or primary care? And how do we work with the trust and the work with Tim and Filigoff in terms of the social prescribers and the navigators? And how do they actually become the linchpin in the middle to actually work with those patients, support them while they're through, so that we can actually just understand what's going on with the patient and what alternatives can be provided in the interim just to support them. So the trust is really keen to work with us on that one. They are working through which specialties that would benefit most. So whether that's trauma and orthopedic in terms of pain and that, so that the social prescribers can actually work through as to what's out there in the community. And we're working up a plan around it and trying to get this implemented through the winter to support these patients. So that's okay.
Okay.
Thanks for detail.
I think there's quite a few people who want to speak, so I'm going to go to Kate Page, then to Stuart Bloom, then to Rami Elliott. Yeah.
Thank you. So general practice is under a lot of pressure at the moment, and a significant amount of my day, but more importantly, probably my secretary's day, is spent with patients ringing their GP surgeries, asking us to chase and expedite and write strong letters for them and try and be their advocate, which is part of our role. I just wonder if there's a way of us being able to get the trust or somebody to communicate with these patients and give them a contact number or a sort of an email address that they can communicate with, because the patients only know to come back to their GP when they don't hear from the hospital. And I just think it would be a better system for general practice if there was a number that the patients could ring or an email address that they could contact, rather than use our valuable time at the moment.
More than that, they're advised by the secretaries at the hospital to contact the GP for an extra letter. So it's more than just they don't have anywhere else. They're actually being advised to go by the GP.
Absolutely.
And so you're absolutely right. And that's where the role of what we're trying to create is the role with the navigators to become the linchpin in the middle, rather than all that going back to the GP, who absolutely can't do anything else with it, but looking at what other alternatives can be there as well. Unless obviously the patient's symptoms have changed, that's slightly different. But what we need to do is to say, rather than getting just the general calls, to say, where am I in the bucket list or the line of in terms of treatment?
But I think having some proactive communication for the patients that we know are on the list needs to happen, rather than us wait for those patients to contact. If they were aware, actually if they knew there is this backlog, this is the problem, this is where you are on the waiting list, it might help to reduce some of those contacts.
That's exactly the plan, to proactively contact these people and to give them an offer of what the support will be in the middle.
Yeah.
Okay.
There's a comms plan. There's a comms plan at West Herts about the patients that's going to go through PALS at the Trust, and that they're actually being advised that the secretaries shouldn't be advising patients to go back to the GPs. That is part of the comms plan. That's all involved within that group that's trying to manage this.
I think what we're hearing is that there's a whole system approach is needed. It's not actually the individual parts. I'm just really conscious of time. So Stuart, then Rami, and then I'm going to.
Just quickly from my point of view, I spoke to Kate Chand earlier this week. My concern over the timing of these reports. I mean,
close, please, Stuart.
Sorry. Sorry, can you hear me now?
Yeah, we can. Yeah.
Okay. I spoke to Kate Chand earlier this week because my concern about looking at June data is almost worthless now in terms of being able to understand what's going on. And I understand because the Quality Committee meets every other month now, and the timing of the board is out of sync with that. Really, to have a report like this, although we have to bring it to the board, I just wonder if there's a way of, without creating more work, a single page update on key information that comes to the board, rather than just wait for Claire or somebody else to give us this update. Because here we are in November looking at June data, doesn't give us any satisfaction on what the current position is. So I talk to Claire, Kate and Gemma regularly, and I think I'll talk to them outside the meeting how we can get more relevant information to the board.
Okay, really important point. Finally, Rami, and then I'm going to draw it to a close. Thank you. Rami, you're on mute.
On mute, sorry. The recurrent thing that comes across is information about how long do I have to wait? What would have been my wait? What do I do next? I just think we need to have a standard piece of information per department, per specialty that just goes with the offer, just goes to the patients and say to them, this is your expectations. I think if we do that, we will solve probably about 60 to 70% of the anxieties. The other thing that comes is when they are trying to access private support through their private insurers, the insurers want to know what would have been the wait during pre-COVID time. So maybe something like that going in would have been quite useful as well.
Okay. I mean, I think some really important points that have been made. But Claire, I think this was for assurance. Yeah, it was for assurance. Yeah. So I think some really important points that have been made there, and hopefully we can get some updates in the weeks and months ahead. Yeah.
Nicholas, I do just see there's a few comments from Brian in the comment box about mental health.
Okay. Yeah. No, I think that's important to address it. Yeah, please do.
So there's not much in this report, Brian, about mental health, but I have got some in the updated report. I know you've asked about adults, but just to let you know about the CAMHS, they did dip their performance earlier in the year, but that has improved. As far as HPFT, they did stop some services like MDAS during the first wave, but they have restarted that and they are getting a throughput now. They have seen originally they saw a dip in referrals, but now they are seeing that increase in referrals, and they are working on ensuring that they get seen as quickly and appropriately as possible. The actual data set we don't have, but what we can do is do an update for the board on that and ensure that's included in the metrics for next report. Okay,
thank you, Claire. Really important point, and I think all of general practice would agree that has been one of the striking features is the tsunami of mental health demand and some of the log jams and getting people seen urgently.
We did have a deep dive with HPFT as well at the previous quality committee due to some of these log jams you talk about, Nicholas, and did start working through that, and we will be following that up.
Yeah, just to say that Healthwatch has had meetings with HPFT as well, and there is some concern about early discharge of people perhaps inappropriately with psychosis. I mean, some of us are long enough to remember Jonathan Zito back in the 90s and what happened there, and with inappropriate, not a follow-up of people who are discharged in the community. So it's a patient safety issue, I think, that we probably need to think about.
Thank you, Brian. Okay, I'm going to draw that to a close now. Move straight on to Alan, which we have the finance report followed by the financial plan months 7 to 12, and they're both, well, the first one's for assurance, the second one's for approval. Over to Alan, please.
I think it's probably Nicholas. I don't know if Alan is here. I can't see him.
He was a moment ago. Yeah. Hi, Alan.
I am here. I mean, if Elka wants to present it, then by all means, I'll let Elka present. The only thing I was really going to say, I see her shaking her head, is that this is the last month of the kind of emergency regime where, in effect, we're operating in a non-cash limited environment with top-ups being available. So as at the end of month 6, we're reporting an overspend of just over £1 million, but most of that is associated with COVID costs, which are recoverable some overspends on prescribing, and a big underspend because they gave us too much money in the original figures. So I don't really want to dwell too much on the month 1 to 6 position, because we're expecting to receive the £1 million top up, which will bring us back to balance. But I'm very happy to answer any questions that people may have.
Trevor, did you have a question?
Yeah, so just really briefly, I think I brought this out at the Finance Committee as well. Just a couple of the areas of areas of overspend in the first 6 months were prescribing and CHC. Now, I think it might be worth just. So my question was really about the trajectory over the next 6 months of those, and it might be worth just touching on the plans and possibilities on those 2 areas, please.
Elke, did you want to come in on that?
Yeah, I can do probably slightly more detailed. So we're bringing a deep dive paper on CHC to RMT, and it will come to Finance Committee in January. So that's where we will set out in the full detail of the trajectory of placements, packages, both in terms of volume of activity and the cost. So we will bring that. We're just working through that now with the team. Your other question, Trevor, was on prescribing.
Prescribing, I think Sarah Crotty took that, and obviously there is still risk there with the with Brexit, and therefore, yeah, how that's being handled.
Yeah, that's right. I mean, the budgets that we had been set for months 1 to 6 have obviously been set nationally, and they didn't have quite the same growth applied to them that we may have done in the original plan. They were not that different though, so it's probably more a case of not having been able to achieve the efficiencies we had planned. So we are quite confident that overall we can manage, but there's clearly a need for the PMOT team, along with practices, to try and constrain costs as much as they are able to in the current environment. So I think we could probably expect some pressure on those budgets for the remaining 6 months of the year, but we're confident that overall we can manage that.
Okay. Any other comments on the up to month 6 before we move on? No. Okay, Alan, if that's okay, can we move on then to the month 7 to 12?
Okay. So again, thank you to Elke for producing all the papers. So the financial regime reverts back to something that's a bit more normal. We are no longer able to just seek top-up funding if we overspend, but the same instance, we don't have any underspends clawed back. The slide shows you the difference between month 1 to 6 and 7 to 12. There's been some changes in terms of block payments that we make, but again, the underlying theme is the ICS and individual CCGs were given the funding that NHS England believed they would need to spend in months 7 to 12. So teams will have gone through to identify likely costs and potential efficiency savings that could be made to identify whether or not we believed as a system that we could live within those financial envelopes. In Herts Valleys, we originally had a small deficit, but further funding was confirmed in primary care that will come through in month 7. So we were therefore able to submit a balanced plan. That's not the same across the ICS as a whole. Originally, the ICS put in a deficit of 16 million. Subsequent to that, we've been asked as an ICS to reduce that to 12 million. Some of that was covered off by the additional funding that was received for primary care. So all 3 CCGs, the benefit was about 1.5 million, and the rest of that was met by the NHS providers. So as an ICS, we submitted a plan that is to spend £12 million more than the funding we were originally promised, and we believe the discussions that have been held between the regional and national teams will result in additional funding coming to us. So as things stand, Herts Valleys itself has a balanced plan, and the ICS as a whole we expect to be in balance with the additional funds that will come. There clearly are some risks still within those plans. So one of the tables shows you COVID spending in the first 6 months and the second 6 months, and second 6 months COVID spend is significantly lower than the first 6 months. But some of that is because the hospital discharge programme is no longer funded within our envelope. Instead, it will be a reclaim from NHS England. So the numbers aren't necessarily comparable. The other risks we've identified, efficiency. We are all being required to make efficiency savings. So the holiday, shall we say, that may have been in place for the first 6 months of the year, we're now back to work and we have to deliver those efficiencies. In terms of waiting lists and clearing the backlog of patients, we touched on that earlier. The risk is probably greater for next year rather than this year, but the more we do this year, the better we are, both for our patients but also for ourselves financially going forward. In primary care, there is still the promise of the funding for the additional roles reimbursement scheme, and I think again it's something we should be pursuing as much as we can, being as flexible as we can in terms of the roles and the reimbursement, particularly given the pressures we have in private care. It would be a shame not to be able to draw down funding that's been made available. So we have to try and be as flexible as we can with our PCNs and work with them. I think in terms of the other one that I think Trevor's already where we are continuing to see higher cost per patient. At the moment, I think the bed numbers available mean we can still get throughput of patients, but that may again become more difficult as we go through. So something to be mindful of. I was going to leave it there. The last slide sets out the budgets by heading, and I'm happy to answer any questions that that people may have.
Okay, thanks, Alan. Any questions or clarification? Paul.
Yeah, I mean, just to confirm that we discussed all this in Finance Committee and were content with the proposals as they were laid out for months 7 to 12.
Okay, so we are, unless there's any other comments, we're being asked to approve the month 7 to 12 financial plan and budgets. Do I have everybody's approval? Yeah, thank you very much, Alan. Yeah, thank you.
Thank you.
Okay, moving on now to, we're slightly behind time and conscious that we've got another private meeting afterwards. So Juliet, over to you for the communications and engagement report. And this is for discussion. Thank you.
Yeah, hi. Yes, thank you. Yes, I know there isn't much time, and just to say that I did want this report to be a really short one, but it's been a busy few months, as you can imagine, and busy to come as well. So I'm just going to pick out a couple of things. I want to make a particular reference to our reader panel, because we think they've been doing an amazing job. There's been a huge amount of material which they've looked at that's been of real benefit. They've looked at and really contributed to the quality of an older people's leaflet that we've produced. They're currently looking at a children's leaflet, and we did do a bit of a review to get some feedback from them, and they gave some very helpful feedback about how much how they would like more time to review things, which sometimes isn't possible, but absolutely we can make some effort in that direction, and also just to make sure that we always give them feedback when a document is published, but we really value them, so I kind of want that on the record, really. David's already mentioned the hospital redevelopment, but I think in that context, all I want to say is that we are, having reached a particular milestone when the boards agreed early last month in terms of the way forward, that we are doing a bit of a refresh of our engagement. And we have obviously operated in the last few months under really difficult circumstances with only being able to do things virtually. But we think it's now time that we look at that. We look at how we can start to engage with some of the communities who generally we haven't really been able to have conversations with. So for this next phase, in terms of the OBC, that's really what we're looking to do, and to have some really more detailed conversations about some issues around travel, design, and all that kind of stuff. So we're really looking forward to doing that. COVID, obviously our work has been dominated by COVID, and as you can imagine, things change pretty much every day. I mean, today I've just literally, while we've been on this call, had an email and some information about Hertfordshire going into tier 2 next week when the lockdown is lifted. So a lot of material that we will be producing and sharing along with all our partners. So a lot of work that we've done has been about encouraging, compliance, I suppose, public behaviour, the Play Your Part campaign, and also specific information about testing around self-isolation and so on. Vaccination is going to be a particular focus. I spent most of my day yesterday on meetings around how we're going to communicate it. Huge challenges. There'll be a big central programme, but a lot that we'll be doing locally to reassure people, manage expectations and all the rest of it. Can I just quickly also say something about staff engagement, actually, just to say, and I think I know David mentioned it in his piece earlier, the importance of making sure that we do look after staff under these still strange circumstances they've been working under for 9 months now. We would usually have had a staff conference back in May. We obviously didn't do that. We couldn't do that in person. We are going to have just a short staff conference in December that a group of staff themselves are planning, and the main topic there is work in a virtual world. But we think that's should be a really helpful opportunity to help people connect with some colleagues, which isn't always easy under these circumstances. And in that same vein, we are introducing a new series of breakfasts with exec members. We've done that in the past, and we've had really good feedback around that. Sadly, we won't be producing croissants or bacon sandwiches or anything, because it's all going to be on a screen. But we've had feedback that people really welcome those opportunities. It's very informal, there's no agenda, and it's really a chance for people to just talk about issues of concern or interest to them with whichever exec member they happen to land up with on that morning. And I think I'll leave it there for reasons of time.
Thank you, Julia. It just occurs to me that maybe as a board we might consider writing to our patient, our reader panel, to thank them for their work, because I think they're doing it purely in a voluntary capacity, and at the moment that getting their input is so important. They've done a fantastic job. So if everybody's in agreement, I'd like.
I think that would be great, Nicholas.
Yeah. Okay. Thank you. Any other comments? I think Juliet, for those of us that sometimes have the documents to approve, I think we realise the depth of work that your team are doing at the moment, and it is incredible, and it's at pace, and you attend so many national meetings and then try and filter it down to us. So we're really grateful for you and the team. So thank you. Yeah, as somebody says, I think Trevor's saying another busy year. Absolutely.
Yeah, thank you.
But I think it is a real highlight of the work of the CCG, and that is really important to carry that through into our successor organisations. Yeah, thank you. Okay, Alison wants to say something. Sorry, before we
just to confirm, I just think it's amazing that the team has been, as well as doing all the COVID stuff and the planning for the future as well, they've actually been involved in maintaining business as usual, forging new links across the county, preparing, for transformation, thinking about how we might interact with PCNs. They've been operating on 3 distinct strands of activity with the same team, the same people. So it's just amazing that they can carry that kind of work and do it with such commitment. And Juliet did comment on the fact that we are very heavily reliant on Zoom-based, meetings. Actually, they have actually turned into quite a key strength of ours at the moment. We've been running some fantastic 1-hour sessions on specific themes that have gone down really well with our public and extended our public reach quite considerably. We've attracted a whole new audience to those things. So just the team has been working incredibly hard on 3 different fronts. So thank you very much to everybody.
Yeah. Paul, you wanted to come in briefly?
Appreciate that.
Yeah, I mean, I think another really good report, and I feel sometimes because it's always one of the final things on the agenda, we don't get to do them justice. But I thought I would just add as an aside. So thanks very much for that, Julia. And as an aside, if you're looking for a tier 1 place to go, it's Cornwall, the Scilly Isles, or the Isle of Wight. Good luck.
Okay. Yeah, but if you live in tier 2, you're not meant to be travelling, or if you do travel, then you're meant to be following tier 2 rules in tier 1. Sorry about that, Paul.
Exactly. Absolutely. Okay. Thank you, Juliet, and thank you to all of the team. Okay. Very, very briefly now, the committee minutes I'm going to take as they're attached for information. I'm not necessarily expecting anybody wants to say anything about any of them. If they do, perhaps they can just quickly raise their hands. So moving on, I'm going to take that as a no. Review of the conflicts of interest were managed in the meeting. Well, we didn't have any conflicts of interest to declare at the beginning, so and I don't think any particular ones came up during the meeting, but perhaps Iram or Katie, if you've got any views on that.
No, nothing to add there.
No, okay. Reflection on equality and diversity in relation to decisions. Perhaps, that's obviously very pertinent to today's discussion. Any quick reflections on that? I mean, it was a very rich discussion. But did actually that also feature in some of our other decision making? Is that something perhaps to reflect on? I think we've exhausted you. Okay. Risks identified during the meeting. Iram, any specific ones that came up?
So it's not really a new risk, but just to note the EU transition risk on the corporate risk register, it will just be reviewed by ELCA and the team in light of the new national guidance. And just one more, the lack of elective capacity within paediatric and oral surgery.
Yeah, no, very good point. I think the only other thing I would just add is that obviously we just need to make sure that, as I said, that rich discussion we had in terms of equality and diversity, and that the BAME report does feature in the various parts of our risk register and our BAF. So perhaps just a thought just to go back to it and just check that it is adequately reflected.
Sure.
Okay. So unless there's anything else, once again, really good wishes to Rod and to Tracy, and we look forward to seeing, in fact, are already seeing Avni and who else have I've forgotten somebody? Oh, Lynn, of course, Avni and Lynn in their new roles. And I can see, yes, that Brian's dog has joined the meeting, and we were delighted to see he or she. And what's their name, Brian?
Dexter. Chocolate. Hey, look, you see, he's come to say hello. He's wagging his tail.
Hello. Okay. Right. Lovely. That's a nice way to finish the meeting. And just a reminder for those of you in the board, there's a private meeting starting at 12:30. Thank you very much, everybody. Okay.